At 40 weeks, my blood pressure decided it wanted to creep up. That, combined with swelling and increased protein in a cup, were indicators that my body was under an abnormal amount of stress. So my midwife checked to make sure my baby wasn't in distress. After confirming that she wasn't, we made the decision to induce because there was no way I was going to the hospital with COVID on the loose. So we decided to start the process at 12:30 the next day before the diagnosis of preeclampsia could have the final say. Because I know that once labeled, put in a box, and categorized, protocols can result in our desires and our design being trivialized. It could have quickly gone from allowing me to try for a natural delivery to the onslaught of medical interventions presented with chivalry. From bed rest, magnesium drips, epidurals, and Pitocin, to baby distress, time constraints, and an imbalance of oxytocin, to a C-section delivery because they had to get the baby out. And please hear me, I am not saying this is never the right route. But what I am saying is that many cesarean deliveries could be avoided if a mom's designer, and inherent power weren't nulled and voided. If she knew that unnecessary intervention can actually slow progression, and that although Pitocin strengthens contractions, it can also result in regression, that it can cause her uterus to squeeze too forcibly and make it hard for her baby to breathe, and that instead of getting rest between contractions, she can feel like there is no reprieve. It's the lack of true informed consent that presents the biggest issue, and all that trauma goes on to take up residence in a mother's tissue. It manifests itself later as fear of getting pregnant again and self-doubt, when all she needed in the first place was time to let the baby come out. So with nipple stimulation, position changes, and the strategic breaking of my water, modifying my movements and breathing based on what was noted in the monitor, the belief of my family, midwife, and doula that my body could indeed do it, and the strength of my heavenly Father in a warm bath to get me through it. My daughter was born in 4 hours and 47 minutes in the water, and she was laying on my chest within seconds of when the midwife caught her. While my husband cut the umbilical cord and my vaginal tears were repaired, my newborn breastfed with her big brother and self-appointed protector there. After a few hours of ensuring my body settled down and our baby was okay, my midwife left me with orders to rest and take my blood pressure twice a day. But resting is relative, right? So as is customary when a new child makes an appearance, we invited family over, did a newborn photo shoot, and considered this adherence. So within days of delivery, my blood pressure climbed to unprecedented heights. And as I'm reading this poem, I realized it was my body exercising its rights to tell me I was overdoing it, that my blood vessels and kidneys needed time to heal, that the threat of kidney failure and having a stroke after delivery was all too real, that I had resources and support and I needed to use them to the fullest capacity, or the things the OBGYN said that I was assigned to could have some veracity. To my face, he said, "Your kidneys won't recover. I've had patients like you before. You'll be on blood pressure meds for the rest of your life." Can you imagine what he said behind closed doors? I'll tell you. He said he knew I didn't have a regular doctor and I wouldn't follow up with him if I did, and that on the off chance I survived, my body wasn't fit for having another kid. That considering the fact that I was older, black, and lived most of my life in the South, he was certain I had high blood pressure pre-pregnancy and couldn't control the food I put in my mouth. He didn't care that my record showed my blood pressure average to be 100/60, or that I worked out almost daily and my resting heart rate barely made it to 50, or that when the preeclampsia was discovered, my blood pressure was about 128/80. So I'm pretty sure that had he been my birthing provider, his assumptions could have killed me and my baby. And this is one of the mistakes that underlie maternal death, infant mortality, and avoidable complications, along with protocol-driven inductions and C-sections and a lack of focus on individualization. There's a lack of intercollaboration, communication, and care coordination, referrals to other healthcare providers, and inter-office visit recommendations. Think about it. For every woman who had a kidney injury, there's a renal doctor who can help. For every bony malalignment, there's a chiropractor with experience under his belt. For every instance of uncontrolled high blood pressure and heart failure, there's a cardiologist. For every woman who needs higher surveillance during pregnancy, there's a perinatologist. For every vaginal tear, displaced uterus, and weak pelvic floor, there's a physical therapist. For every woman struggling with anxiety and postpartum depression, there is a mental health specialist. There are doulas who are present for labor, delivery, and afterwards to provide intercession. The point here is that for every need, there is a healthcare provider to provide intervention. But the reality is, with the pace of the healthcare system as it is, things can be missed. And sometimes issues experienced or communicated are inadvertently dismissed. So Operation M.I.S.T exists and persists to fill in the gaps and shore up the team. So eliminating the maternal health crisis can become more than just a dream. Now, instead of being seen 2% of the period they are at risk for complications, they are monitored 100% of the time by healthcare providers from a remote location. Providers who learn the details of a mom's day-to-day life, desires, concerns, and fears, the nuances of her diet, exercise, commitment, stressors, and what brings her to tears. Then combine what they learn with information from a smart device to establish a unique baseline. So women are never compared to anyone else and their physiology is never undermined. For when she deviates significantly from her norms through text or phone communication, a brainstorming session ensues to determine the cause of the deviation. Most of the time, the underlying issue can be corrected with lifestyle modification, and at other times, the changes warrant deeper and further investigation. As a result, between visits, infections, anemia, and preeclampsia have been identified. Additional healthcare providers have been added to the team, and new plans have been solidified. Moms have avoided unnecessary inductions, C-sections, and preterm deliveries, and have been empowered to ask the necessary questions and embrace self-advocacy. In short, Operation M.I.S.T exists to provide birthing providers with what they need to make data-driven decisions, to ultimately result in less medical interventions, complications, and needless incisions. It exists so women know what is expected to take place by virtue of their biology, how hormones can affect what takes place physiologically and psychologically. It exists so women can have better outcomes and make more informed choices, so that when asked about their birth story, those listening hear joy and peace in their voices. It exists so women don't settle for just being grateful that they and their baby survived, but instead take pride in knowing they did all they could do to not only live but thrive. It exists so women make choices while pregnant and following delivery that won't negatively impact them later. And so they know the power that resides within them that was strategically placed by their Creator. It exists so women can get back to being in tune with and trusting their intuition. And so the maternal health crisis no longer instills fear but results in clearer vision. This poem was written so you would know the why behind our unrelenting determination to educate and empower as we live up to and follow through on the following dedication. On our honor, we will strive to serve moms and their babies, to monitor faithfully, intervene meaningfully, and create an environment where both can thrive.